I've been practicing motivational interviewing for the last 5 years or so, and I really enjoy it. I think there's a lot to really love about this approach to working with patients. So yeah, I'm excited to kind of dive in and see what we can learn about it today. Should I just go ahead, Christina?
Yes, go ahead and share your screen if you have slides to share.
Yeah.
I'll allow you to share your screen here. Please allow Emerson to share in the security setting.
Okay, let me try now. Oh yeah, here we go. Okay. So yeah, we're going to talk about motivational interviewing. But before we get started, I actually was just really curious to start off with learning a little bit of what people in the audience's level of familiarity with motivational interviewing is. What do you already know?
Really now about motivation interview.
So yeah, I'd just love to hear a little bit from some of you. You could either put your answer in the chat, or if you want to unmute and sort of speak up a little bit, let's hear about what do you know about this approach already?
So you can either type in the chat box or speak up if you want to share your opinions. Has anybody heard about motivational interview?
Yeah, and if you haven't heard of it, if you don't know anything about it, that's also okay. I'd like to know that.
Oh, I think your screen got uh,
Oh, here, let me see.
share again. Okay. All right. So I think motivational interview is a very different and very new concept to a lot of people.
Okay.
Uh, so let's learn more about it.
Okay. Sounds great. And yeah, I'm seeing a response in the chat here. I want to understand more about motivational interviewing. Um, and are there any differences between this and therapy for patients with mental issues? Yeah, that's a really good question. So we'll get into that a little bit today. Um, okay. Um, so let's see here. Oh, can't use the arrow keys. Um, so first of all, I want to start off by talking about something they call the writing reflex in motivational interviewing. And so maybe to share this, I was wondering if Christina, would you be okay participating in a quick exercise to demonstrate this?
Of course, I would
Okay.
love.
Okay, cool. So I'm wondering, is there maybe some kind of change that you've been thinking about making in your life that you feel ambivalent or some mixed feelings about making this change? And I know I'm putting you on the spot here, so if nothing comes to mind, that's also okay. You could maybe role play a patient who this might be the case for.
Mhm.
Um, what do you think? Is anything coming to mind?
I think one of the most common things that we see in a lot of patients is they want to they want to lose weight. They want to exercise more. Mhm.
Yeah. Yeah, that's a great example. I relate to that myself, as those are changes I would love to make. Um, so I'm wondering, would you be okay talking as if you are a patient who's struggling with that kind of change for a second?
Sure.
Okay, and what I'm going to do is I'm going to role play, and I'm going to um, well, actually, I'm not going to tell you what I'm going to do, but I'm going to talk with you about this change a little bit. Okay, so you can go ahead. Maybe I'll be the doctor here, and I'll ask you a little bit about. So, what change are you hoping to make, Christina?
I want to exercise more.
Okay, I'm well. That's great because it's really important that you make that change. So, do you think you're ready to go ahead and do it?
Somewhat ready.
Okay. Well, it's really important to be more than somewhat ready because this is really going to help your health to actually go ahead and make this change. Okay.
Mm, yeah, I guess.
Yeah. Well, I'm hearing you say, I guess, but you're going to be a lot healthier if you make this change. It's just really important for you to take care of yourself.
I know. That's
So,
why I want to do it. That's why I want to exercise.
okay. So Christina, can I just ask, in this brief like interaction we're having, how am I making you feel? Like, how are you feeling about this change as we're talking about it?
I feel like you are, uh, you kind of say things that I already know,
Okay.
and you are not really, well, I feel like you are trying to force me.
Hmm.
And like I say that I'm not, like, I'm like somewhat ready, but then you be like, no, you cannot be somewhat ready. You need to be more than ready. So it's like forcing me to be in a place where I'm not there.
Yeah.
Mhm.
Yeah, that makes a ton of sense how you're feeling. And I'm sorry, I'm feeling bad for interacting with you that way, because it doesn't feel very good, right?
Right.
Um, but that's like a trap we often get stuck in as medical professionals, where sometimes we feel that these changes that patients are thinking of making, we know it's going to be really good for them and it could improve their quality of life or their health. And we have a lot of knowledge to share, but sometimes, like you just said, it can make the patient feel sort of forced, and they can actually end up resisting more if we are trying to push them or use our knowledge to convince them. So that's something in MI that they call the writing reflex, or this reflex to try and right people, to fix them.
Mhm.
And we try to avoid that. So that's something in MI that we're going to do a little bit differently. Um, oh, and when I say MI, by the way, that's just shorthand for motivational interviewing. Same thing, but people like to call it MI for short. Um, so motivational interviewing is a collaborative conversation style for strengthening a person's own motivation and commitment to change. So the idea is that, unlike what we just did, it's more collaborative. We're working with the patients, and we sort of have to accept in this approach that we can't force someone to be motivated or committed to change. All we can really do is try to elicit their own motivation or commitment that already exists, to the degree that it's already there. We can sort of strengthen and heighten that, but we can't sort of force them to change.
Mhm. So, if you have some confusion about what we just did earlier, so that is an example of what not to do.
Mm.
Okay, what not to do with a patient.
Yeah, exactly.
Mhm. Okay.
Um, there's also this concept called sort of the spirit of MI. And the idea here is just kind of thinking about how we want to use this approach. And the idea is, you want to be kind of like the top picture, where we're with patients, we're kind of alongside them, just being guides and supports to them. And you don't want to be like this bottom picture, where we're sort of scolding patients or lecturing patients, or kind of we're on top teaching them what to do and they're on the bottom kind of just getting instruction from us. You want to just hold this relationship a lot more gently than that. So any ideas, if motivational interviewing is an approach that is trying to help people be motivated to make changes, you can just go ahead and put this in the chat if you have any ideas. What kinds of patients might benefit from stronger motivation, commitment to change? What kinds of patients would we want to use this approach with? Any ideas? What kinds of patients might benefit? Elderly patients. Yeah, that's a really interesting point for sure. There's lots of lifestyle changes and things that elderly patients might be wanting to make. Any other kinds of patients who might benefit from this? Emotional patients. Yeah, definitely. As a behavioral health person, I work with a lot of those. Alcoholic patients, definitely. Motivational interviewing was actually first developed for working with patients who are drinking, using alcohol, and using drugs. Young patients, yeah, for sure. I was just working with a young patient this week who was struggling to make some changes, and I was using some of these approaches. So yeah, these are all fantastic ideas. On this next slide, I was kind of just trying to make the point that we all just made, which is that a lot of different kinds of patients, we end up working with them on trying to make changes, trying to be motivated in one way or another. Patients who want to talk about themselves, yeah, for sure. I was thinking here on the top left of patients like with hypertension, some of these chronic diseases, we often do a lot of behavioral management. You all said alcohol, which is great. Emotional patient on the top, kind of, I was thinking of a patient with depression. Medication adherence, like patients taking any kind of medication, people often struggle with that. Working with families. I'm seeing in the chat open-minded patients, but a little bit of lack of determination and need someone to encourage them. That's great. Absolutely. That's exactly the kind of patient who MI is great for. Okay, so we can use this with lots of patients who come and see us. So I suppose the next question is, what is MI? Like, how do we do it? What does it look like? So it consists of these 4 stages. And I'm going to go into each of these today so that you get an idea of how this whole approach looks. So first off is engaging. And do I have a slide about? Yeah, okay, so we'll go into engaging first. So this just means kind of engaging with the patient. It's so easy for us sometimes to get stuck in our charting and EHR system and stuck behind our computer. And we want to really come out from behind that for a few moments and just be genuine and connect with the patients who are in front of us. We also want to remember that we're just guides to help them live their own best version of life. Our job is not to give them unwanted advice, but rather to help them with their own goals. And then MI kind of has these strategies for how to engage with people that they call ORs. And that stands for open questions, affirmations, reflective listening, and summaries. So open questions, I think I have examples of this. Yeah, so they kind of differentiate between closed questions that you can ask a patient versus open questions that you can ask a patient. Now, the idea is just we want to ask questions that get people talking to us. You know, it's so easy for us as providers to go in and we have so much information we need to collect. And so we can end up just asking people a bunch of yes or no questions. And then the patient's just sitting there giving us one-word answers. Like, yes, yes, no. And they're not really talking with us, which makes them not feel connected to us, not feel like they can really give us their story, and not like we're someone they can trust. So looking at these closed questions, it sounds like you eat a lot of unhealthy foods. Are you worried about your diet? What's the patient going to say? They're just going to say, yes, I'm worried about my diet. And then we're not really getting anywhere. A different way to ask something like that might be to ask the patient, what are some of the different feelings that you have about your diet? That gets the person talking and explaining stuff to us more, which gives us more of an opportunity to show them that we are someone they can trust. Do you want your son to start behaving differently? Again, they might answer with just, yes, I do. And we don't learn very much from that. Whereas if we ask something more open-ended, how does your son's behavior affect you? Then the patient's really going to start talking with us and we can build trust.
Do siêu âm lọc máu cục.
Okay.
Mắc Doppler với lại tiền sử cách đây 2 tháng mới mổ sỏi bàng quang. Nói chung là ôn cực kỳ phức tạp, kêu cách đây 2 tháng mổ sỏi bàng quang mà không lẽ lại không thấy. Xong rồi cực kỳ thắc mắc luôn.
Speaker. Okay.
There we go. Okay. So I was thinking we can practice doing some reflections. Now, this is another one of these ORS skills for engaging patients. And it just means that after we've asked one of these open-ended questions, we want to reflect back what the person has said. I'll show you one example. So if the patient said, Christina, would you mind going ahead and reading this patient quote?
I'm worried about my eating. I love sugar and carbs, and that's all I've been eating. I have gained weight and I feel terrible.
So then I, as the provider, might respond to you. Wow, it sounds like you've been feeling really terrible recently, and it's making you feel worried about your eating, even though you really love to eat sugar and carbs. So I'm just kind of reflecting back what the patient said. And this seems really simple and kind of obvious, but it's so important because when we do this, it makes people feel really listened to, and it makes them feel much more open to anything that we might suggest because they feel like we understand them. And again, I know that it sounds really simple, but I just cannot even tell you the number of times where, we'll be shadowing and things like that around our clinic, and providers don't always take the time to do this. And because, we're busy and we have a million things to do, but it's so important because it can really maximize the trust that you get from patients and how willing they are to make changes. So I'd love for us to practice this a little bit. So I'll show another patient quote. And what I'd love is maybe in the chat, if we could just type, what is a reflection that you would give? Like, what would you say back to a patient that kind of restates what they have said? So here's another quote. So let's go ahead and hear in the chat, how would you reflect this statement back to a patient? How would you restate to them what they said?
Anybody want to read this first? Anyone want to volunteer to read this? You can unmute yourself and read this if you would like. Anybody from Smart Communications want to volunteer? From my course, Smart Communications. I see Dr. Tu here.
Yes. Let's
Okay.
read this sentence. Smoking marijuana helps me sleep at night. I might be using it too much, but hey, it's a plant. So how bad can it be?
Thank you. So marijuana is commonly used now in the U.S. as a recreational drug. So you will see this a lot if you talk to American patients. So how do we reflect this back to the patient? How do we paraphrase this to the patient? So I see Gue, it seems that you feel marijuana helps you have a good night.
Yeah, that's a great reflection. That's kind of exactly the kind of thing that you might want to say back to this patient. Because again, it might seem kind of not intuitive to say that back to a patient, but it really helps them feel listened to. Like if you were to say that back to your patient, they'll feel like, oh, this doctor's listening to me. They kind of get where I'm coming from. And we can work towards change from there, but it's really important to start from this place of them being listened to. So I'll show you another one. Anyone want to go ahead and try reading this one?
Anybody want to read?
Excuse me, may I?
Yes, of course.
Yeah.
Thank you so much. I've considered talking to a therapist about my depression. I wish I just feel better. I don't know.
Awesome, thank you. Yes, that's that
Thank you
just
so much.
sounded exactly like some patients that I can think of. So let's practice with this too. So you can go ahead and throw in the chat if you want. What would you say to summarize this back to a patient, to kind of restate this back to them? How would you respond?
So something I like to do to do the reflection is either number one, I kind of repeat what they say. Number two is paraphrase it. So repeat is just kind of pretty much say what they say, and then paraphrase is try to word it differently, and that is enough to show them that I'm listening to them.
Yeah, those are great strategies to use. And I'm seeing here in the chat, you feel having a counselor may help, but you are unsure. That's perfect. That's exactly the kind of, paraphrase that we might want to use here. Because again, the patient's going to feel like, yeah, that is how I feel. I'm unsure, but I think having a counselor might help. Mm-hmm. Maybe I'll talk to this doctor some more. I'll open up a little bit more. Yeah, as Christina said, you can even literally use almost the exact same words back to the patient. So here, I'll type like another example in the chat. Like you might say something like literally just, you've considered talking to a therapist about your depression. Felt better. That's like, you can literally use almost the exact same words. People don't notice that, people usually are not like frustrated with what you're doing. They just feel heard when you do this. Seeing some more reflections coming in. I'm sure you're planning to talk to a therapist about your depression to feel better. Yeah, that's great. Just kind of saying back to them what they said. I think you've experienced a hard time lately. Don't be scared. You have me now. Yeah. So that's an example of what in MI they call like a complex reflection. So the idea is you're kind of reflecting back what the person said, and you're adding on a little something, which is like a guess about what they might be meaning, even if they didn't use those exact words. So you can do that too. So in that reflection where you say, I think you've been experiencing a hard time lately, that's great, because the patient didn't exactly say that, but it's a pretty reasonable guess that based on what they said, they probably have been experiencing a hard time lately. We're not making like a wild assumption there. That's a pretty safe guess. And so the patient may end up feeling really understood, that you were able to read between the lines of what they said and learn something about them that goes beyond what they actually said. So that's a really great reflection. Okay, I think this is the last one. Let's try this. So go ahead, like we've been doing in the chat. Well, actually first, does someone want to jump in and read this one?
Yes.
Awesome, thanks. You can go ahead.
It's me. It's the same me. I love drinking Pepsi, and the caffeine helps me wake up. Honestly, I know on the sugar is bad for me. I should probably stop. It's the same thing. I think the caffeine helps me wake up, but I don't want to stop.
Yes, it's funny, some of these changes that we talk about are really real, right? We can really relate to these things.
Yes, caffeine help me wake up, and more emotion, more more better. It's better to work to.
Well, I'm struggling to wake up too here, so I understand. But yeah, I really hear that caffeine helps you to wake up, and it sounds like it's really helpful for you for that reason. So that's something I might say back to you if you were a patient talking to me about this, because yeah, it's important to show them that we're listening to them and we understand how they feel. Oh, here's another one coming in the chat. You're thinking about stopping drinking Pepsi even though you love it a lot. Yeah, that's excellent. Again, so you're using pretty much the same words as what the patient said. You're just kind of reordering it a little bit. That's going to make the patient feel super heard. So this is kind of stage one, engaging. Oh, so those questions that I asked you all at the beginning of this, those are actually some engaging questions that you could also use in stage one of motivational interviewing. So instead of asking it about motivational interviewing, because that's what I was asking you all, you could change this and you could say, what do you already know about caffeine and how it affects you? Or you could say, what do you already know about eating a healthy diet? What do you already know about alcohol and trying to stop drinking so much alcohol? Because most of the time, patients who come in to talk to us, they've already been talked to by other people in their life or by doctors, or they've done internet searches. They know something about this change that we're asking them to make. And so rather than kind of telling them a bunch of stuff they already know, it's much better to start by eliciting some knowledge from them. And similar, oh, go ahead.
Yeah, I think that's a really great point, because a lot of time, so I think it's great for two reasons. Number one, patients feel they have a chance to share with us what they know. And number two, it's easier for us because we know what they know and what they don't know, so that we can target our response more effectively, and we don't have to say everything.
Yeah, totally. There's like nothing worse than when you give like a 5-minute explanation of something to a patient and then they're like, yeah, like I already know that. Because that's just a waste of everyone's time. Oh, I saw another reflection of the Pepsi patient coming in the chat here. And so I know you love Pepsi because its caffeine helps you wake up, but you also want to give it up. That's excellent. Again, these are just really great reflections of these patients. So ask them about their situation, ask them open-ended questions, ask what they already know, and then reflect back to them what they're saying so they know you understand. That's stage one. Stage two is once you've gotten the patient talking to you, they're feeling comfortable with you, they're telling you all this information, then you want to kind of narrow the focus of the session because we only have so much time that we can spend with a patient. So there's different ways to do this, but one exercise that MI sometimes recommends is that you can actually kind of write down in, on a whiteboard or on a clipboard or something. You can draw some circles and write down the different topics that a patient is talking about. So like if we had a patient who came in and was maybe saying a lot of the quotes that we just went over, whoops, oh shoot, oh actually I'm gonna have to do this. You guys can still see my screen when I'm like this, right? Okay. Yep. So like, let's say the patient had this concern about drinking less Pepsi. And then, so I would literally with a patient, I would do this. I would be writing this in these circles, like on my clipboard or something. And then, oh, I also heard that, you've been wanting a therapist. So there's that. And then maybe, what was one of the other things? Let's say exercising more. So I'm hearing these different things from you. There's kind of a lot of changes that you're talking about making. So then I might ask another open-ended question to see if we could focus on one of them. So I might ask something like, what really makes you feel drawn to one of these changes? Can you tell me about that? Or like, what really appeals to you about one of these changes? Can we talk about that a little bit? And then the patient could, choose one of these things to talk a little more about. And then I might ask, so is that where we should focus the session today? I feel like I'm hearing that this change is really important to you. So should we put that at the top of our list? And sometimes with patients, I'll keep kind of like a list, like instead of doing this in circles, you could do it, just kind of like vertically, right? You could make a list and say, okay, so we're putting this at the top. And so we'll work our way down and we'll see how many things we can get through today. But let's start with this top one because I'm hearing that's really important to you. Or, you can always sometimes too be like, all right, let's spend most of our session talking about drinking Pepsi because I'm hearing that's a really important change for you. And then I'll set a timer on my phone and we'll make sure we spend 5 minutes at the end of our session talking about wanting a therapist because I know you want to get to that too. So you kind of it's important to have some kind of agenda or structure for what you're going to do with the session, because that way you can use the time best. And in MI, the idea is we kind of want to be focusing on one thing at a time. And this is a way to help us get there because, as you all know, patients are going to come in and they want like lots of things and it can be really confusing sometimes. They have a whole bunch of things that they want. And we can be more effective when we're focused on just one topic. Okay, so then we get to stage 3, which is about evoking. And so what we really want to do here is we want to get patients into what we call change talk. So if you haven't done much MI before, you might be wondering what is change talk? So change talk is contrasted with something we call sustain talk. And basically, MI just thinks that there's basically these two kinds of talk that patients are going to come in and they're going to do. And sustain talk is going to be talking about sustaining a behavior. So they're going to be talking about not changing what's going on. So an example of that might be like, I don't want to stop drinking. That would be sustain talk. And that's the opposite of change talk, which is where a patient could come in and they could say something like, I really want to stop drinking. Can you help me with that? And that would be change talk. And the idea is that the more we can get patients to shift into change talk, the better. So I have some more examples here. So you can see like change talk would be, I worry about the chemicals in my cigarettes. I've heard that they are nasty. A sustain talk patient would be, I'm not that worried about smoking. My dad smoked and he lived until he was 92. So that's kind of the difference between these two kinds of talk. What about this example? Anybody have any ideas? Is this change talk or is this sustain talk? Okay, somebody's saying change talk. Any other ideas? Change talk or sustain talk? Okay, somebody else is saying sustain talk. Interesting. Mixed. Sustain talk. So we have some different ideas here. Change talk. Combine change talk and sustain talk. Sustain talk. Yeah. So this is kind of a tricky one, right? And so you're basically, everyone is correct about what you're saying about this example. It is mixed. It is a little bit of both, right? So there's the change talk part of this, which is, I know I probably need to manage my hypertension better, like working out more often. That's change talk. But then there's also sustain talk in here, which is, but I just have to work so much to support my family. I really don't have time to be exercising. So this is probably a much more realistic example of what patients will say than those examples in isolation where it's only change talk or only sustain talk. Patients are going to come in and within the same breath, they say, both of these things. They say, I want to make a change, and I also don't want to make a change.
Mm-hmm.
So this probably sounds really familiar to be looking at this. No, I don't want that yet. Sorry. So yeah. So basically what we want to do is we want to reflect back to them the change talk parts of this. We want to respond to these mixed statements in a way that gets them doing more change talk back to us. And we know we're doing our job well if that starts to happen, if the patient starts to go from this to more and more statements that are purely change talk. And we know that something's going wrong if we keep responding to the patient and then they keep coming back with just more sustained talk. We want to take them from this mixed place into a place of more consistent change talk. And we'll talk a little bit about a strategy to try and make that happen in a second. So you can, to try to evoke change talk when you're not hearing very much of it, you can use variations of this thing called the miracle question. And so the classic example of this is this first bullet point here. Anybody want to go ahead and read this first bullet point? This is something you could ask a patient to try to get change talk happening.
Anyone would like to read this? Let's practice English.
Excuse me, may I again?
Yes, of course.
Yeah, the first sentence is if a miracle happened and you woke up tomorrow never wanting a cigarette again, what would be different in your life or work?
Awesome. Thank you. Yeah.
Yeah.
So yeah, that's something I ask patients versions of this question all the time. I would say maybe in like most visits that I have, I'm asking something like this to patients because it gets them talking about change. You know, you ask people this and or just anything kind of along these lines, and people will start talking to you about why they want to change, what kinds of changes they want to make. This is a really consistent way of getting people to talk like that. Other versions are what else you see here. So how would you like your health to be in 5 years? How would your life change if you did stop drinking, stop smoking? How would that change your life? What strengths or advantages do you have that would help you make this change? These are all questions you can ask with patients who are really stuck in sustained talk. If they just come in and they're like, I could never make this change. I could never stop drinking. It's just not ever going to happen. I feel really defeated. You can ask them some of these questions to get them talking in a more motivated way. So then once you've gotten them answering some of those questions and they're talking more about change, they're giving you some change talk, then you want to try to reflect it back to them, just like we just did earlier. Use those same strategies of restating what they said, paraphrasing, summarizing, just to make that change talk even stronger for the patient. Now, if they keep giving you this mixed stuff where they're saying, yeah, I kind of want to stop drinking, but I also don't think I can, some change talk, some sustained talk, then you want to try this thing that motivational interviewing calls double-sided reflections. Now, double-sided reflections is basically reflecting back to them both parts of what they said. So you want to reflect the sustained talk, but you also want to reflect the change talk. And ideally, you want the change talk to be the last thing out of your mouth. So the last part of what you say should be the part that's connected to them making a change. And the reason for that is because the patients, when they start talking, they're probably going to pick up on the very last thing that you said. So if you end with, well, I hear a part of you really wants to make this change, but I also hear a part of you doesn't want to make it at all, then the patient's probably going to respond with, yeah, I don't want to make it at all. I don't want to change. Here's why, you know, and so on. Whereas if you instead go, so I hear this part of you that really doesn't want to make this change, and I also hear this part of you that kind of does want to make the change, then the patients will more likely come back with, yeah, you know, there is this part of me that wants to make the change actually. And let me tell you about that. So you want, when you reflect both sides of what they're saying, you want to end with the change talk part. So these are all different examples of how you can do this. You know, you might reflect back to them. So on one hand, you want to make or you don't want to make the change, but on the other hand, it sounds like you do want to make the change. Or you could, I use this middle one a lot. I say to patients, so I think I'm hearing one part of you that's really scared of how hard it might be to change your diet. But there's another part of you that actually wants your blood pressure to improve, that wants this change to happen. You also can just literally, you know, use and or but to sort of connect these things. So, you know, you're worried about making this change and you also want to make this change. You can do that too. So want to practice this a little bit. We'll give some examples and I want you to try putting in the chat, what would a double-sided reflection of this patient statement look like? So if the patient said one of these things and you wanted to reflect both the sustained talk and then at the end reflect the change talk, how would you do that? So here's a patient statement. I always get sick from the flu shot. I don't want to get the flu, but I don't want to get sick from the flu shot either. How could you do a double-sided reflection of this? And I will, I'll put an example in the chat too. So there's one example of what you could say that I put in there. Yeah, I'm seeing some others come in. You don't want to get sick from the flu shot, but you also don't want to get the flu. Perfect. Yes, that's exactly what you could say. And I love how in that example, you put the reflection of the change talk at the end. You know, you're starting with a sustained talk and then you end with, but you don't want to get the flu, because the patient's probably going to come back starting there. They're going to say, yeah, I don't want to get the flu. And that's what you want. You want them in that change talk. I can hear you don't want to get sick from the flu shot, but you don't want to get the flu itself either. Yeah, perfect. These are great double-sided reflections for this patient. What about this one? How would we do some double-sided reflections for this? What would we say? I think caffeine is starting to mess up my sleep. I have to drink it to stay awake during the day. Oh yeah, this is what we were just talking about. I have to drink it to stay awake during the day, but then I can't sleep at night. And I know I function better with a full night of sleep. How would we do a double-sided reflection of this? Let's see, I'll put an example in the chat also. So I might say back to somebody like you drink caffeine. You might say something like that to somebody. It sounds like you need to drink caffeine to function during the day, but you also need a full night of sleep. You feel caffeine is affecting your sleep. You have to stay awake, but you also want to have a regular sleep behavior. Yeah, perfect. But caffeine can be helpful to my heart. Yeah, I mean, that's true. Like some of these behavioral changes, they're mixed, right? But you know, I don't know about you all, but we do see a lot of patients here, at least, who are really concerned about quitting caffeine, and so it's a common one that people are concerned about. Okay. yes, everyone's addicted to Instagram. I'm going to skip this one for time though, and just let's look at this one. Oh, sure. Of course you want to talk about my smoking. You're going to tell me to quit just like everyone else does. Okay, fine. If it was that easy, I would quit. Do you think that I like being a smoker? So I'd love to see in the chat some examples of, oh, great. I'm seeing some more come in with the caffeine one. That's perfect. Yeah, some of these are really good that I'm seeing in the chat for the caffeine one. Let's go ahead and put some in the chat of how you would do a double-sided reflection for this. Because this is like a really real thing that patients will come in with, right? Where they're frustrated and they're angry at you and just at the world. That, you know, people are always telling them to make this change. They're really mad. And motivational interviewing can be a really helpful strategy for dealing with patients like this, because making them feel listened to and heard can really de-escalate. It can make them less angry and start to feel a lot more trust. So I'll put an example in the chat here of how I might try to do a double-sided reflection to this patient.
I think everyone knows the smoking is unhelpful for health. Everyone knows. Everyone always think about the quitting smoking, but is they get a lot of several reasons for smoking. Wicked smoking may be hypertension, gain weight, or don't concentrate when they are working. I think there are the main reason to that they want to quit smoking, but I don't do it. Yes. Some patients can get me about their reason. There's several reasons they can quit smoking. Yes, I think the quitting smoking is the most important for patients, because they have a lot of reason to smoke.
Yeah, I mean, I think that's exactly the kind of situation where we might want, you know, where MI is like, that's exactly what motivational interviewing is designed for, is these kinds of patients where they have a lot of reasons to smoke, and they also, like you're saying, they also have reasons why it's not good for them. There's issues that come with it, like gaining weight or whatever it might be. I think helping patients from that place where it's really mixed, it's change talk and sustain talk, and helping them go from that into, you know, into real behavioral change. That's exactly what some of these kinds of strategies can be really helpful with. I'm seeing a lot of great reflections here in the chat of this patient who's kind of frustrated. So then the last stage, and I'll just go through this quickly because I know we're about at our time, is just to help patients make a plan. And I think this is maybe one of the most comfortable ones for us, right? Because we're taught how to do this, right? How to plan with patients and how to, you know, help them focus on a change. But the idea with MI is we don't want to just come in and do this first thing. We want to build this rapport with patients, get them talking to us, and reflect back to them a lot before we just start making a plan with them. Because then by the time we get around to this, they're a lot more likely to actually listen to us and follow through. So these questions I have for you all, but also these are the kinds of things you could ask patients after you've had a conversation, right? You know, you could ask them, you know, so after we've been talking today about your smoking or about your caffeine, what do you want to take into your life? What do you want to do after our conversation? Over what period of time do you think you want to do that? What steps will you take? Now, notice again, these are all open-ended questions. They're not me directing what's going to happen. It's all the patient directing what's going to happen. But because we've been having this conversation where they've been opening up to me, they've been telling me about their smoking and all their mixed feelings about it. Then when I just ask them simple open-ended things at the end of that, what do you want to do? What do you want to do after our conversation? They will often just start talking themselves into these changes that they want to make, rather than me having to tell them what they should do. So this is kind of what we've gone over today: engaging patients to connect with them first, focusing onto one topic for today, or at least setting an agenda, evoking change talk from patients, getting them to start talking about the changes they want to make and what they're thinking and feeling about it. And then at the end, kind of just asking them what kind of plan they might want to create based on the conversation and what steps they might need to do. That's kind of how MI goes. So I guess we're exactly at 7 here. I don't know if anyone has any questions or comments, or if we have time, or you're always welcome to reach out to me if you have any thoughts or questions about this. I'm super happy. You can reach out to me by email and I will definitely respond and be happy to engage with you guys.
Thank you so much, Emerson, for a very, very helpful and informative talk today. I think that everybody enjoyed our session today with the interactive and get a chance to practice and put what we're learning into daily practice and help us to become more empathetic, more understanding providers, doctors, nurses, and also help patients to have better outcome because they able to commit to a change and they feel like they own those changes.
Yeah, thanks, Christina.
Yeah. So everybody, thank you for joining us today. We do have a survey, a feedback form in the chat. If you can take a minute to fill it out for us, that would be wonderful. If after you fill out the form, we will send you a certificate of completion for today's session. So please do that. And we will also have this session available for reviewing on our YouTube channel. Please follow us on YouTube and Instagram and Facebook and TikTok. We're everywhere so that you can get updates for our next event. So please take a few minutes to do that. Thank you very much. And lastly, let's take a picture together before we end our session. So if everybody can turn on their camera so that we can remember this event today that we're here and learning about this. So let's take a few minutes. Thank you so much, Emerson, for your time today. I know it's a Sunday morning and you spend your valuable time with us preparing for this talk and sharing with us all your knowledge. We really appreciate you.
Yeah, thank you so much. This was really an honor to get to do this. And I will send, I can send Leon or send out the slides too, in case anybody wants that as a resource.
That will be wonderful. I will include that in the email, the follow-up email after you fill out the feedback form for us. So we send the certificate of completion and the slide for you, and you can review that and try to practice some more. Okay. All right. So let's send some heart here to our lovely speaker. And we're gonna take a photo together. Okay. So All right, I see a lot of hearts coming. Wonderful. Thank you. Thank you. So, let's, okay. Okay, on 3, 1, 2, 3. Thank you, everybody. Have a good day, and I hope to see you again at the next event. Goodbye.
Thank you so much.